Good morning, everyone. Thank you for joining us for what I'm sure will be a very interesting and engaging discussion about improving preventive care. While prevention often gets lip service in health policy discussions, we're here today to give it a full embrace. Specifically, we're going to be talking about the Preventive Services Task Force. This is a little known set of 16 volunteers that help us navigate what works in preventive health and which services truly save lives. And as importantly, which services don't. I'm very much looking forward to the conversation. So first, I'm going to introduce our guests, then we'll get our conversation going, and then we'll leave some time at the end for audience questions. So if you're in the audience and would like to submit a question, please do so in the chat function. You can do that at any time, and hopefully we'll get to it towards the end. Alrighty, let's get started. So our guests today actually need no introduction. They've both dedicated their lives to public policy and service and are very well known in this town. So I'll be very brief here. Joining me today is former South Dakota U.S. Senator and former Senate Majority Leader, Tom Daschle. Good morning, Senator. We're also joined by former Oregon Congressman Greg Walden. Mr. Walden served as the chair of the powerful House Energy and Commerce Committee. Welcome, Congressman. Look forward to chatting with you both.
Thank you.
Great. So I'm going to start off the conversation with a question for you both. Senator, I'll turn to you first. Preventive care often starts with a personal experience. How is this work personal to you?
Well, Ladan, first of all, let me just say, give my thanks to the Third Way for your interest in this subject. It's so critical. It's one that I've spent a little time working on for many, many years now, and really appreciate you drawing attention to the task force. And thank you for moderating. And let me say what a real pleasure it is. I've been an admirer of Congressman Walden's for a long time, and we have the occasion to work together from time to time, and really appreciate joining him on this program today. But you're right. I don't know of anybody who hasn't been affected by preventative efforts over their lifetime. I've literally had countless preventative tests over mine: colon, heart, skin, blood, dental. Part of the reason I think I'm in such good health today is because I've had such good preventative care over my entire life. I've had a number of close friends over the years whose lives were literally saved, and I'm not being dramatic here, literally saved by early preventative screening. These experiences have made me a true believer, and I just wish we fully appreciated the magnitude of what preventative healthcare can mean to our country as we look to the future.
Absolutely. Congressman, what about you? How is this work personal to you?
Well, and I want to join Senator Daschle in thanking Third Way. And Ladan, thank you for moderating this panel. And as Tom said, we've been able to work together on some of these areas in a city that often doesn't work together in these days. It's fun when you can, and we are. And this is really important work. So I want to thank Third Way for the effort here. A year ago this week, my wife finally was able to get back in and get her annual mammogram about 6 months late. At that time, they detected a little growth, and it was cancerous. And she was able then to get in and get care. And we think everything's going to be fine because it was caught very, very early. I think of all those people during the pandemic like her who could not get in to get colonoscopies. Mine was delayed. I think of people who didn't get the kinds of tests that the Senator mentioned. And we all know when everything shut down in 2020, all healthcare went to, the thing that was the most critical at the time, the pandemic. And yet we know then everything dropped off. I was in seeing my skin doctor the other day because it turns out when your head looks like this without a lot of hair on top, sun is a pretty dangerous thing. And they occasionally find things. And so, my mother died of ovarian cancer. My father had bladder cancer. My wife's dealt this blow. And so preventive care really, really matters. And as a policy person, I think it saves money. And it brings about better health conditions for people. So it's a win-win. where you can actually head off a much more expensive procedure if you capture it early. And that's better quality of life too for the patient. So we're all affected. And it turns out these awful things don't choose you based on how you're registered to vote. So we all got to work together on this as a country.
Right. And I think that's so true because, as you said, it leads to better outcomes. So we just can't discount the importance of the work. So, Senator, as we saw with COVID-19, many died because they didn't get vaccinated. Is that a problem with other kinds of prevention as well?
Absolutely. And I just go back to something Greg just said that I think really should be emphasized. Preventative care is not only a health issue, it's an economic issue. It's an incredible opportunity to save lives first, but then save resources second. And I don't think we fully appreciate the magnitude of those savings. And Greg and I have struggled over the many years with both OMB and CBO as they score savings around prevention. And it's one of my greatest frustrations, frankly, that we don't get more credit for preventative care as a result of the extraordinary savings that are generated. But to your question, 3 in 10 people today, 3 in 10 people who should be getting colorectal cancer screening don't receive one. 75% of the people who die from colorectal cancer aren't up to date on screening. That's a pretty incredible statistic when you think about it. More than 90% of the people at risk for lung cancer aren't getting screened today. 90%. We're almost 9.5 million people miss cancer screenings, we're told, due to the COVID pandemic, which is certainly exacerbating the problem of under-screening that we already have. We've seen that as a real problem, especially in Africa. I work with a number of different health entities that offer care in Africa, and the whole measles problem in Africa has gone up dramatically because children have not been able to be screened and tested and vaccinated. So COVID has presented some real challenges with regard to exacerbating a problem that of underscreening that was already a very serious one before COVID even began.
Right. So the senator just touched on some gaps that exist in the system and how that leads to, much worse outcomes for folks. So Congressman, why should policymakers care about this gap?
Well, I think for a couple of reasons. First, there are inequalities in access to healthcare, and they spread across the spectrum. Some are based on racial issues, some are based on rural issues. It's basically access and affordability. And it's something we've all tried to work to improve. But the end result is my former congressional district was about the size of the senator's state. And so you get out in these rural areas and you realize it's a long way to get care. And then you have to leave your job. You have to maybe stay overnight to get to a hospital that can actually do some of this work. I mean, figure out childcare. There's just all these barriers to care that we have to overcome. And so for some people, they go, I just can't afford it. I can't take the time, so I'm just not going to do it. So what happens? They don't get screened. And then something is developing in their body they're unaware of. And sometimes it's too late. By the time they're sick and feel it, it could be a cancer that once it gets to that stage, there's nothing that can be done. Good news is most Americans want to get screened. They want to prevent bad health outcomes. And to Tom's point, we've got to figure out as policymakers, or the policymakers are in office today, how do you do this in a way that gets past the budgeteers and the green eye shade folks that would always tell, whenever we would put forward a proposal about preventive care, could be backed up with all the science in the world, they'd come to us at CBO or from OMB and just say, oh, that's going to drive up the cost. You have to pay for that. Now, we know long-term, if you catch something early, the costs can't be as high as somebody that's in a later stage, but they would always just count the one side of that, in my opinion, and not the other. And that's why I think the work that the Third Way's done here is really, really helpful. And I know we're going to get into that, but where you also identify areas where we can save money by stop paying for procedures that don't achieve a good benefit. And that should free up the money. We would call that an offset to pay for ones that do. And so we've got to modernize the system. We're not keeping up with the change nationally that's occurring medically. And there's a big opportunity here.
Absolutely. I'm going to come back to you, Congressman, for that, to talk a little bit more about that. But I want to push on something that you touched on, which is how important preventive care services are at an early stage, and how in the long term that really sets us up for saving lives and also having a good economic impact. So, Senator, how do we know what types of preventive care services actually work? Like, what can you tell us a little bit more about that?
That's a great question. And yes, it's been the subject of a lot of study. Scientists, medical experts for decades have really devoted a great deal of time and attention. The problem is that they oftentimes come up with conflicting and confusing and actually many times even incomplete results. And that's really what motivated the Reagan administration way back in 1984 to propose what we now know as the United States Preventative Service Task Force. It's their purpose, really, to sort out the evidence, to end some of the conflict and the confusion, and really bring a greater degree of clarity to the real question of what works and what doesn't. It's a volunteer group of clinicians and researchers that, as I said, started in 1984. And it provides a very useful service. It's not often you get a grade in something outside of school, but what the task force does is provide grades for preventative services based on the strength of evidence and how beneficial the service is for a group of people. And so offering that analysis and then providing some clarity with regard to their confidence about that analysis with an actual grade, I think is a real service to this whole question of what works and what doesn't.
I'm just going to stay with you, Senator, here. So you mentioned that this was created under President Reagan, but you had a personal hand in the Affordable Care Act provision that uses this task force's grades to then tell insurance companies which services should be covered free of charge. Tell us about that.
Well, I think it's such an innovative idea, and I wish it were mine, but it wasn't. Nonetheless, it really, I think, just transformed to a certain extent the opportunities for access to better preventative testing. What the Affordable Care Act allowed for the first time was to provide for free preventative services if it gets an A or B grade from the task force. So the process is pretty simple. The task force evaluates a preventative service, makes its best assessment, provides a grade. The ACA then says, okay, if it's an A or a B, that service is going to be free under the Affordable Care Act. The idea was to expand the use of prevention, and that's exactly what happened. It worked in remarkable ways, especially in certain services like blood pressure checks, cholesterol checks, and flu vaccination. So it's one of the concepts that I hope we can keep building out as we consider just how we might use this grading system and the availability of these preventative tests going forward.
Absolutely. So with the task force being so important to preventive services and preventive care, how do we make sure that we're keeping up with the advances in the sector? So for example, in our recent report that we released this week, we found that since the 80s, when the task force was created, the number of randomized clinical trials has grown by 600%. So how can we ensure that this task force is keeping up with all this new information?
Well,
Congressman, I'm going to go to you.
I think there are a couple of things, and I might build on the prior topic as well to mention that then in the Trump administration, we actually expanded further access to high deductible plans for preventive care. So before you pay your any kind of deductible, these high deductible plans would cover for free these same recommendations. So what we've done over time and over presidencies and parties is figure out where preventive care gaps are and how do we continue to expand access for all Americans to be able to get access to preventive care as things change. We live in an amazing time as humans. When you think about what we just went through with the pandemic and are still going through, the notion that you could come up with multiple vaccines in less than a year for a virus we didn't know existed is historic, literally historic. And then you realize with this technology that's been developed, we're on the precipice of addressing multiple health issues in a time period that is so compressed, it blows the mind. And so you talk about the 600% increase in these trials. We're going to see that continue. In the meantime, we have 16 volunteers and a budget that's been frozen in place for more than a decade, and say, okay, now you go through all these things and every 3 to 5 years, figure out what should be covered. I think we have a structure begun in the 80s, reformed in the 90s, and again in the 2000s, that now we find ourselves in 2022 asking, is it still working in the right ways? And we're asking a lot of volunteers who meet irregularly. I mean, there's a schedule, but they're not there every day. They've got real lives, a limited amount of staff. And so I think it makes sense to review how that process is working with today's medical and research advancements. Because the last thing I want, and I think any of us want, is to have some screening, revolutionary screening opportunity to prevent a really bad disease or cancer and have it linger for 3 to 5 years and not be out there and available, because we know it'll save lives, we know it'll save costs, we know it's been approved by the right clinicians, but we have a process in place that just frankly is moving too slowly. And so I think for the policymakers of today, they're going to have to evaluate that. And it's time, because the speed of medical advancement, the speed of testing advancement. I mean, we're on the cusp of having colorectal cancer treatments done through blood. And you know how much fun it is to get prepped and ready to go to get a colonoscopy. Just nothing more fun than that. And so a lot of people won't do it. Same with the other systems that are out there where you have to check your stool and all that. Somebody says, I'm not doing that. But we know people get blood tests. So, I mean, we're on the cusp of a lot of these things, and yet we have a system in place, I think, that needs some additional help.
Absolutely. And I'm glad you brought up some of the strides that was made during the Trump administration as well, because as we've said, you know, this doesn't have to be a partisan issue. This affects everyone, no matter what your party ID is. So I think that's really important to emphasize. So thank you for that. Senator, so we've talked a little bit about the importance of the task force and, you know, why their work is so important, but their budget has been $11 million and it's basically remained unchanged in 10 years. You authored an op-ed with former chairman of the Senate Finance Committee, Max Baucus, that the task force can't do its job without adequate resources. So we, Third Way, has proposed doubling this budget. Do you agree with that?
Absolutely. I couldn't be more emphatic in agreement, especially on a number of Greg's comments about how things are changing and how important it is now for the task force to be empowered to accommodate all of this change. And you know, and keep in mind, we're talking about volunteers here. That's what's amazing to me. It's really remarkable that something this important relies on a budget that hasn't changed in 10 years and on volunteers who, out of their own goodwill and willingness to be contributors to better health, are willing to commit themselves. So the task force needs additional funding without a question. And I think your proposal, the Third Way's proposal to double the budget is the minimum we should do, frankly. They need to be able to review prevention topics more often than every 5 years, which is currently what they do. Given the plethora of tests, I mean, they don't have the capacity to do it any more than that. And so as a result, we we aren't getting the full value out of a concept as important as this could be. Plus, they just released a comprehensive plan on equity, and I'd certainly like to see them fully execute that plan. They're not even able to keep up with the current level of reviews because of the cost of the evidence and the amount of resources that demands. And so it's increasingly a real problem in terms of their efficacy and their ability to fulfill this great aspiration that is now decades old. This fact was actually recognized recently, and some of our viewers, I'm sure, are familiar with this, but it was officially recognized with the Agency for Health Insurance and Research and Quality, AHRQ, the budget justification in 2023. They warned in that justification that the cost of evidence reviews has increased over time, and therefore, with the same level of support for the task force, if that doesn't change, they're going to be forced to compete with fewer evidence reviews with each coming year. That's the bottom line. Fewer reviews, less ability to stay abreast of the changing, this almost transformational time. And so the need for a stronger budget couldn't be more compelling.
Absolutely. So to build on that, Congressman, you touched on this before, and I really wanted to ask you about it. So the task force gives some services, A to D ratings, which means that a D means that it doesn't help and sometimes could even hurt patients. Right. So obviously the government shouldn't be paying for those services, but since the implementation of the ACA, no president has implemented the option to not pay for those services. So should Congress require the administration to stop paying for these services that clearly aren't working?
Yeah, it's a really good question. And of course, as soon as you say, oh, we're not going to pay for X service, there's obviously a constituency around that service. Somebody's getting paid a lot of money to do a service and they want to keep getting that. So there'll be a blow up. But I think one of the advantages we have is the work like you've done here, Third Way, that identifies these procedures. And frankly, that the task force has too, that's identified. We have independent arbiters of this matter that are scientists and clinicians, and they have figured out, here's what you're paying for, you shouldn't be paying for, and in fact could actually be doing damage. The analysis is upwards of $500 million. Let me underscore that, $500 million a year. Now in Washington, that $500 million can get your attention. You go back to Tom's point, the budget for the task force is $11.5 million. We're wasting $500 million every year. So I think, whether you mandate something or whatever, getting something passed into law is hard in Washington. Doing oversight's not. And I found when I was on the oversight subcommittee of the Energy and Commerce Committee, I actually could get a lot done just by shining a light on a problem. You shine that light on the problem, and all of a sudden people go, oh yeah, well, okay. And we got a lot of change that way. So whether it's a mandate or whatever, the point is we got to figure out a way to identify it, to amplify the attention on it, and then to fix it. Because what we really need to be doing is spending that $500 million on new preventive services that we know work, but are waiting to be approved and funded. And I wanted to just highlight one other thing in your report when you said in the 1980s, when the USPSTF was established, medical knowledge doubled every 7 years. In 2020, it doubled every 73 days. So back to our discussion here about these 16 volunteers with a budget frozen in time that's a decade old, how are they supposed to keep pace? And the loser here is the taxpayer who needs access to preventive services. And so there's a lot of work here. I think this is teed up for probably the next Congress. Just because this one's got enough on its plate before they would get to this. But boy, there's an opportunity for bipartisan work here to fix this.
Absolutely. Just want to remind the audience that they should please submit their questions through the chat function. We are going to turn to one that we got now, but please keep them coming in. So this is a question, and Congressman, you touched on this before, about people in rural areas. So is the federal government looking into funding remote patient monitoring devices as programs as an alternative option to screening patients in person? So just to broaden this a little bit more, can you talk a little bit more about access to rural areas and telehealth, remote patient monitoring devices, and how this plays into preventive care?
Mark me down as a big fan of all of the above, because the district I represented. And so you'd have these small rural towns and have limited access to healthcare. I remember going out to Enterprise, Oregon, and touring the hospital. This was 10, 15 years ago, and they'd just gotten high-speed broadband in. They could take, you get in an accident out there, they could take the x-rays. They could send that literally overnight. I mean, in the middle of the night when you didn't have anybody on staff particularly around. But there was a service, as I recall, in India with trained physicians who could read the x-ray and report back immediately. I mean, they had figured this out, and it's like, wow. And then meeting with people who could sit in a small hospital, communicate with a bigger hospital in Oregon, either in Bend or in Portland, with the right level of care that they actually needed, and not have to drive, some literally 80-year-old person who shouldn't be out on the roads in the middle of icy winter road driving to go sit to get a 10-minute evaluation 4 hours away. They could sit in their local hospital with a camera and do all that. When the pandemic hit, I remember being in meetings at the White House with the Secretary of HHS and the head of CMS and the president and others, and they were waiving all these rules that were in place that had held up access to telehealth services. And you know what? It opened a whole new opportunity for people wherever they were, as long as they had connectivity, which is a whole nother set of issues. But if they had that, they then could connect and they could get instant access to healthcare. And then you realize, why aren't we doing more of this? Why do I, when I think maybe I'm sick, have to go sit in an office where everybody else is sick and we're all sitting around waiting for our appointment time, right? Isn't it better that Tom's in his house and I'm in mine and you're there and we do this? I think it is. And so I think we are on the cusp, both through technology, so telecommunications, and through medicine, through the evolution there that you're seeing, of something that is revolutionary that should result in quicker access to better care that will reduce costs and improve health. I firmly believe that.
Thank you for that. Senator, did you want to add to that?
Well, I just couldn't be more emphatically in full agreement with what Greg just said. I also, as he did, represented a very rural state. And I think telemedicine and telehealth is transformational in every way. There aren't many good things that came out of COVID. I can't think of many at all. But if there is one, it's the increased appreciation of the value of telemedicine and the opportunities that it offered for people in rural areas to get care. And I think that's going to be especially true for preventative services. I think there are so many preventative applications with increased technological advancements that we can make that will, again, save lives and save resources. So this is, I think we're at the cusp of a transformation with regard to healthcare in many respects, and that will especially benefit rural America.
And you think about the explosion of the Internet of Things and all the devices, whether it's a watch that monitors your heart rate or whatever, they're perfecting these devices now to where they can give a trained medical provider access to real-time data regardless of where we are. And so that's going to require some additional public policy intervention. Is it certified watch? Is it whatever? And on the medical providers, you've got states that are deciding, whether you're licensed to practice in their state. Well, okay, I get that in a way. But on the other hand, if I'm out of state, my provider's back in my state, and I'm physically located in a different state, can I go online and have you look at me? Well, maybe not. And so there are these laws and rules stuck in a period before modern internet communications that have to be addressed too. It won't be easy. There are embedded factions and issues you've got to overcome, but I think we've got to
I just want to add to that. That is exactly the problem. You know, COVID provided an opportunity for an exemption for most of these state regulatory barriers and federal barriers too. There are Medicare barriers as well, and those exemptions are expiring now. And there's a lot of debate around whether they ought to be reimposed. And I just hope that people can really appreciate the benefit that we've now witnessed firsthand, and we have plenty of data to prove it, on how invaluable this new opportunity for services can be. And I hope we can do as Greg suggests, make sure that we continue to foster a far more robust implementation of telemedicine going forward.
Absolutely. And as you just said, you know, there's been a few silver linings to COVID, and one of those things has been expanding these services and expanding access, which we keep touching on as one of the biggest barriers to care. Here is another question that we got that I love. How can policymakers communicate effectively on something that's so long-term, but obviously or often invisible to voters? This is not something that voters know about. Lots of people working in the policymaking community aren't super familiar with this either. So I'd like to open it up to either one of you, whoever wants to chime in here.
Let me take a shot at that, because I think Greg just demonstrated exactly the right answer to that question. I always have thought that there were two approaches to making a good argument. One is data, and the other is a personal story. Both are necessary. Data, and we've used both in our conversation today. There's plenty of data to suggest just what the services can mean in terms of saving lives and saving money. But it's stories like Greg's personal story about his wife that I think is extremely compelling. And I think most policymakers are pretty good at telling stories. And the more personal and the more compelling they can make it, the more it can be repeated and understood. So I would just urge those who are thinking about how to articulate the value of this to think it in that context. Think of it as data, of course, but then also think of it as personal story. Your first question was, I think, in some ways, one of the most important, because we can all relate to experiences that we've had with preventative services. And that, to me, is the most compelling argument when it affects you personally.
fully agree. Fully agree. And I think we all have them, right? And nobody escapes these diseases and viruses that afflict us or our families. And that spreads across, from cancer to mental health. And everybody's acutely aware we've got a lot to deal with. And we all have family members that deal with different things. We have neighbors and friends, and they run into these impediments. And then they reach out to people like Tom and me and say, hey, why? Here's what happened. Why does this happen? Why is it when I'm out of state and I have an eye infection, I call my eye doctor and he can't prescribe the medication he always prescribes because I happen to be vacationing somewhere else and I have to go into an urgent clinic where people are waiting to get tested for COVID. I actually know somebody that happened to, and they had to sit in the place where everybody was going in to get tested for COVID so they could get a prescription for the eye medication that they knew they needed and the doctor knew they needed, but he couldn't prescribe it because this person was out of state. That doesn't make a lot of sense to me.
Right. I'm going to push on that because I think it's really important and interesting. We talked about the budget constraints. We talked about how to make the task force more efficient by, not the federal government not paying for services that are deemed with a D score. Are there other ways that the task force can improve its operations that we haven't touched on yet?
I think there are. Go ahead, Tom.
Go ahead, Greg. No, please.
Yeah, I think there are. The early topic update. They have the ability to sort of go back and look at the things that have happened since the last time. but usually it's on a 5-year track. They have the ability to go back and take on some new update along the way. But again, to the underlying problem, you had 16 volunteers, a frozen budget. They've only got so much they can do. And yet I think you've seen in other areas, the American Cancer Society and the National Comprehensive Cancer Network have adopted, frankly, more flexible and nimble sort of living guidelines. And so there are things that can be done as a modernization of the USPSTF. But it's not their fault. They just have the constraints they have.
Right.
It's up to people who followed us in office to take a look and say, okay, how could we make this work better? So I think
I would agree with that. And I would just add one thing. My fear is that if you were going to poll Americans today on, do you know that this task force exists? You might get 1 or 2% that say yes. And if you'd ask them, do you know what they do? My guess is half of those would not know. And so one of the problems we have is just around visibility and around an awareness of who they are, what they do, and the important role they play. So I don't know whose job that is, but as you talk about the importance of budget, some resources to further enhance their visibility and their opportunity to communicate with the American people, much like CDC does. CDC is probably 1,000 times, or many thousand times larger, and even CDC has many issues in terms of breaking through, and so you can only imagine the problem if you're a member of the task force and you really want people to understand your role and your value. But I'm fearful that right now they're almost invisible, and that in and of itself presents a real problem.
Right. I think the Americans who know about the task force are limited to this call right now. So,
yeah, we have every American that knows about it on the.
Yeah, we're all listening. Just a reminder, if we have a few more minutes, if you have any questions in the audience, please submit them now. I'm just going to ask one more of the senator here. Can you tell us about a lawsuit, Kelly versus Becerra, involving the use of task force grades to make effective preventative services free to patients? I don't think a lot of people know about it, but it's important.
Well, it's not made as much news as some of the other lawsuits, but Kelly versus Becerra is actually the 4th round of litigation that attacks major provisions of the Affordable Care Act. It does something, though, that none of the other litigation efforts have done. It seeks to take out several of the provisions of Obamacare governing which forms of preventative care, things like birth control or vaccinations or cancer screenings, must be covered by health insurers. And it primarily relies on the kind of legal arguments that really fell out of vogue in federal courts more than 80 years ago. But there's a twist, unfortunately, through the primary the primary legal argument in Kelly is fairly tough to square with all the legal precedents that have been set now for the last 8 decades. But we've got 5 members of the court that recently signaled that they intend to abandon the legal precedents that have been established in favor of the same interpretation that is now being proposed by the Kelly plaintiffs. So the Affordable Care Act's preventative care provisions could be in for a rough ride, and we should know more about that in the coming weeks.
Interesting. Thank you for that. Congressman, we have just a few more minutes. Is there any last pieces of advice or anything you'd like to leave our audience with today?
Yeah, I think for those who are on this call, on this Zoom, you obviously care about this issue. You've got to spread this out to others so that the word gets up to Capitol Hill. Because I think this is an issue that's ripe for review, for oversight, and for reform. I think there's a natural set of answers here that make sense, whether you're a conservative worried about spending, because you've got all the degrades we're paying for, we shouldn't be, there's $500 million, to anybody who cares about their friends, their family, and their health. Because with the exponential growth in clinical trials and success, whether it's in vaccines or treatments or preventive care, all of that adds up to a better life. And so I think what we've talked about here already, the average lawmaker probably doesn't know this exists or how it operates. And the last thing any of us want, including I'm sure the task force itself, is to become a bottleneck for a prevention or a cure. And so I think this is really, really important, because the cost of accessing care is one of the biggest impediments, in addition to the other things we've talked about, that Americans face. And so how do we reduce that barrier? How do we improve that quality of care? It's all there to be had. And as you can see here, there's bipartisan support to do this. It just takes education, time, commitment, knowledge, and a leader on it. And so I think there are a lot of people on Capitol Hill that would be open to this, but they've got to be told about it. And I think your report, Third Way, really goes a long way in helping.
Thank you. Very well said. Thank you for that. Senator, same question. Anything you want to leave the audience with today?
Well, first of all, I would just reiterate what Greg just said about the Third Way's contribution here. I think it's a very important one. I know we've got a group of people here who obviously are interested, or they wouldn't be part of this program. I always have argued that what we need, in addition to broad support, are a few champions. We need somebody who's willing to make this their cause. And I hope somebody who's listening into this meeting will consider that an opportunity and maybe even a challenge. Be a champion. Help us articulate this. Let's raise the profile. Let's make sure that people understand the value. And let's do all that we can to take advantage of the transformation that's occurring in preventive services. We need some champions. And I hope that some in our audience are willing to take on that new role.
Thank you. Well, thank you so much for that, Senator Daschle, Congressman Walden. Thank you for joining us for this important discussion. Hopefully we can do this sometime soon again and talk more about these important issues that are clearly not, at the forefront of the policy discussion. So thank you again, and have a nice day.